Hello, my name is Tracie Neely, and today I will be talking to you about chronic venous insufficiency. So, the learning objectives for this PowerPoint is to identify the disease, which is chronic venous insufficiency. You're going to be able to identify the etiology of this disease. You're going to be able to understand the pathophysiology of the disease. You're also going to be able to identify what health assessments are essential in order to see if your patient has this insufficiency, as well as possibly some abnormal laboratory findings or tests. Understand the common medications that are used to treat this disease and be knowledgeable of those common side effects of these medications. So when we're talking about chronic venous insufficiency, we're talking about inadequate venous return over an extended period related to varicose veins or valvular incompetence. The etiology is primarily either primary or secondary, which secondary complications usually arise from deep vein thrombosis. According to Hare and Associates, poor circulation, inadequate pressure inside the veins of the lower extremities causing weakened vein valves and insufficient oxygen to tissues are just a few reasons that can cause the inflammatory reaction in vessels and tissues, leading to fibrotic transformation of the skin and then to ulcerations. And basically what that means is when you have inadequate blood flow going to the veins and arteries, that in turn causes poor circulation, which leads to improper wound healing and can cause ulcerations in the skin. Oxygen-rich blood needs to get to those veins, those arteries, in order for you to not have that inflammatory reaction and to have a healthy body system. So when we talk about the pathophysiology of this disease, this is related to either a reflux or obstruction of the venous blood flow, so that the blood flow, whether going toward the heart, going toward the extremities, there is a backflow, a disruption in the venous blood flow, allowing for oxygenated and deoxygenated blood to go where it needs to go. Chronic venous insufficiency can develop from prolonged valvular incompetence, superficial veins, deep veins, or perforated veins. And perforated veins are just where superficial veins and deep veins are connected together. So you've heard of deep veins, such as deep vein thrombosis, superficial veins, or like your varicose veins. So symptoms of this insufficiency include edema of the lower extremities, and that's because of the decreased circulation and the pooling of the fluid from the heart and the lungs. Sometimes you'll see that, as well as edema, you'll see reddened legs or calves. Another is hyperpigmentation of the skin of the feet and ankles, and that's because there's poor circulation. Blood flow is not going through those veins and arteries as it should, and that's why you sometimes will see their legs are like purplish brown. They're very dry, scaly. And when those areas are left untreated, can turn into our next symptom, which would be venous stasis ulcers. And those are more serious than just the hyperpigmentation, and they're hard to heal. Swelling can also be a symptom, as well as aching and cramping of pain in the legs. Movement helps with this insufficiency, and that's because it gets the blood flow going, gets that oxygenated blood to those organs and to the tissues. So some nursing interventions that can be done is, as we said, the symptoms. So the first one we had talked about having edema in the lower extremities. Well, what could you do? You could elevate those lower extremities. Ask your patient, could they, if they have a recliner, if they have extra pillows, or if they on the couch, or lay down in the bed, get some rest, elevate those legs, get that blood flow, get that fluid going back to the heart. Encourage them to wear compression socks. And there's different types of compression socks out there. You can go to Medical Specialty Products company, and or you can even order it online. They have several different brands and types. Some come to just the knee, some come to the thigh, come in different sizes, different patterns, but all of them do the same or have the same purpose, in which it just allows for circulation to maintain in those lower extremities, especially when you're on your feet for a long period of time. So encourage your patients to wear compression socks as much as possible. Make sure that they are removing them at least every 24 hours. Or a couple of hours every day. Make sure that they are not putting lotions or any kind of creams on their skin and then applying those socks, because you can cause for that can be a reactor, cause breakdown in the skin, which in turn goes to our next. Keep the skin clean and moisturized. Monitor your skin daily, because when you have this chronic venous insufficiency, you have your pre-exposed of, or it increases your risk of getting venous ulcers, especially when you have that hyperpigmentation to your ankles and your feet. When you make sure you're washing your skin, you're moisturizing, that you are not walking outside without shoes, that you are inspecting your toes, inspecting your heels, inspecting your skin daily. And it goes in turn with number 3, which is consult your primary care physician if you notice you're having these venous stasis ulcers or any alteration in your skin that you've noticed that does not heal in a timely manner. When I say a timely manner, in a couple of days, if you don't see a healing process, you need to contact your primary care physician. Another is medications. There are medications out there that have been prescribed, especially with people who have chronic venous insufficiency, that will help either combat further symptoms or assist with, preventing further alterations. Another, when you're dealing with chronic venous insufficiency, you want to make sure you avoid crossing your legs, sitting for long periods of time, especially people who work in computers or sit at desk. You want to make sure that you're getting up, or encourage and educate your patients who have desk jobs or sit for prolonged periods of time to get up, take at least 15 minutes to walk around, stretch the legs. Do not cross their legs at the knees or even at the ankles. That cuts off circulation, causes poor perfusion, as well as to avoid alcohol and tobacco use. We already know that those are sedentary lifestyles that allow for or put the patient at risk for getting these complications. So on this slide, I want to incorporate evidence-based practice. I pulled this specific quote from, or statement from, an article by Rab and Pinner. Hopefully I'm not murdering their names too much, but it's a good article to read. Just shows how evidence-based practices such as this compression therapy and it goes along with the nursing interventions I had talked about on the previous slide and how it relates. So here we're talking about risk factors. What are some risk factors that play a part into the chronic venous insufficiency? I apologize. One is sedentary lifestyles. So smoking, stress, alcohol abuse, these lifestyle changes, which can all be changed by choice, can help reduce the possibility of getting venous insufficiency. You know, when you're smoking, stress, or even with alcohol, it's decreasing circulation, perfusion, not allowing oxygenated blood to get where it needs to go. Stress plays and triggers on so many things: hormones, the RAS system, and in turn can cause other complications. Another is medical conditions, so heart disease. So say you have a history of heart disease, can put you at risk for having this chronic venous insufficiency, as well as having a history of deep vein thrombosis, which I had talked about earlier in the PowerPoint when I said the etiology. One of them could be secondary to a deep vein thrombosis. Another is history of extremity trauma and phlebitis. Well, when I talk about history of extremity trauma, that could be anything such as crossing legs, having varicose or spider veins. And what that is just prolonged obstruction of those varicose veins. Another factor is age. As we age, our veins, our arteries, even our skin, the elasticity is not as pliable as it used to be, which causes poor tissue perfusion and circulation. So when you're talking about chronic venous insufficiency, there's some assessments that need to be performed on your patient, especially when dealing with this disease. The first one would be a head-to-toe assessment, and of course I've got as reference the Jarvis physical exam book, and it shows a step-by-step the head-to-toe physical assessment. You need to evaluate and check your patient's skin from head to toe. You need to assess for edema in the lower extremities. You need to feel and look for any swelling. You need to feel for warmth on their calves. Assess for Homensign. You want to make sure that both calves look the same. You want to make sure that the patient is not exhibiting any pain in the back of their calf. If they are, you need to address that and have them seek medical attention. You need to check for capillary refill in the lower extremities. And when I say that, you need to check for refill on their toes. Check and see if there's circulation. A capillary refill comes back. You want to make sure that they don't have any tissue damage. Some assessments that can be done in a doctor's office and not by a nurse would be an ankle brachial index, pressure index. It's an ABI, and this is a tool for assessment of vascular status. Usually it's done on both legs, and it just measures to see if the patient has peripheral or chronic vascular issues. Another is our arterial Doppler study. This one really helps to determine if a patient has a blood clot, especially if they are complaining of swelling, they're having redness to the area. Another is a transcutaneous oxygen measurement, and this is a tool that provides information about blood perfusion in the tissue immediately below the skin. And so when you've got patients who've got that hyperpigmentation and you're having a hard time to see if their tissue perfusion is adequate, this would be a test that you would perform on the patient. Another I want to add is called the CAP classification. And what that stands for is clinical, etiological, anatomical, and pathological. And classification system is most widely adopted scoring system and has been updated in the following 2 decades. And I've got the reference for that listed. And so what this tool is for is when you have a patient that may have a venous stasis ulcer and there's 6 classifications. You want to make sure that you are providing the right kind of care to your patient. And so this tool helps to identify what type of, the etiological, the anatomical, and as well as the pathophysiological classes, so you can determine what type of treatment needs to be done for this stasis. And it is used worldwide. So as well as the treatments, here are some medications. And I'd like to just go back and reiterate, I didn't put on the previous slide any labs, but some to think about would be a CBC. So if a person was to have had a stasis ulcer, checking that lab for white blood count, just to make sure that they don't have an infection. If they have an infection, or if they have drainage that is not serious, you could also get a culture, because 9 times out of 10 they put them on antibiotics, which is what we're talking about right now. So these are some things that could happen to assist to treat those skin infections that could be in those stasis. So in order to understand what antibiotic to put on that patient, they might want to do a culture and sensitivity. These ultimately don't treat the underlying condition of chronic venous insufficiency. However, it does help with the aiding of the complication from the condition. Some antibiotics, and I put an example, is cephalexin or Keflex. Side effects include diarrhea, abdominal cramping, nausea, fatigue, or vaginal candidus. And should that you see that, just FYI, patient education, if you see a patient that's on antibiotic, especially a female, might want to tell them to also ask the doctor possibly for a oral fungal, I'm sorry, not oral fungal, but order for diflucan, because sometimes you can get a yeast infection, and that's what that means, vaginal candidus. Some more medications will be anticoagulants. These help treat blood clots. So when we are talking about the deep vein thrombosis, that's what that means. And it also helps prevent future blood clots from forming. One anticoagulant in particular is warfarin or Coumadin. Side effects include abnormal bleeding, increased bruising, increased risk of osteoporosis or bone fractures. So you want to let your patients know that to look for bleeding gums, bleeding in their stool or urine. If they get nosebleeds that or just start bleeding abnormally from their eyes, they need to stop taking the medicine and go or call the doctor. Another type of medication would be antiplatelet, and this helps with clot formation in arteries. Hopefully I say this word right. Pentatoxylin or Trental is a medication, is an antiplatelet. And the side effects of it is dyspepsia, bradycardia, hypertension, thrombocytopenia, and severe complications would be major hemorrhage. And all these are found in your pharmacology book. And I've referenced that at the bottom of this slide. So in summary, to recap, venous insufficiency is where you have inadequate blood flow that goes to the veins, and it causes tissue damage, poor circulation, and could possibly lead to hypoxia of tissues and organs. Some symptoms to look for is swelling, stasis ulcers, pain, especially when sitting, and aching and hyperpigmentation of the lower extremities. You want to make sure that you exercise regularly, take the medications as prescribed, and you want to make sure that you're checking your skin. There are several risk factors that patients could have. You want to make sure that you educate your patients. Let them know some things that they can do maybe at home that could help alleviate some of these symptoms and complications. I thank you and I appreciate you. I hope you learned something in this PowerPoint. And here's a list of references that were used in the PowerPoint.